ਜਿਹਦੇ ਬਾਰੇ ਅਸੀਂ ਪਹਿਲਾਂ ਗੱਲ ਕਰਦੇ ਸੀਗੇ in terms of what are next steps, right? We can definitely deliver services and care from a mental health perspective, from a medical perspective, but your role as from a Gurdwara Prabandhak perspective is getting access of care to your patients, right? So that could be through their medical provider, that could be through county resources in Virginia. Each county has a community service board, so if there's somebody that's really suffering, and if they can't access that, there's always 988. And 988 is kind of the 911 of a mental health emergency, but you don't need to always call them when there is an absolute mental health emergency. If you need support, there's somebody there that's trained 24/7 to give you that support. So this was more kind of like that immediate need and filling the gap. I think if we do that, you guys will be overwhelmed very quickly once that kind of stigma starts to uplift.
But it's so important for us to have people who look like you and me, like people who are Sikh in the community, talking about mental health and mental illness, talking about depression, talking about how to help people, because who else? I can't come and talk to you if I don't understand how you practice, right? You're not going to be able to understand me. But when you all take back the information to your community, they'll be able to listen to you, right? Because they hear you. You're the first person they call when they come out of their country, from India, from another country. Is there a faith leader in my community that I can reach out to? So you guys are just as important as primary care doctors.
First step is that we want to take this training to the Gurdwaras so that we can raise the awareness. And how this will raise awareness is that the people first language. People don't start calling people bipolar hai, schizophrenic hai, druggy hai. You know, and this has happened. So we want to have that empathy in the hearts of the people. I know it's a very emotional question, but how do we increase the empathy and reduce the stigma is by training. And that's the first next step. And then we do want help from the Gurdwaras to create culturally sensitive training plus resources. I mean, could you guys get us those books?
Yeah.
So Montgomery County has a few books they've printed. They're in English, they're in Hindi, there's 4 other languages, but nothing in Punjabi.
Yes, that is the challenge and issue in our community and other communities as well. It's acceptance. People doesn't accept that we are in this situation, or they don't talk to anybody else in the community. But at an individual basis, few people reach out to us, Guru Sangat Singh ji, and to me personally also, and we try to connect with the people where they could get some help or something like that. But apart from that, there is this program. I'm not sure if you heard about this or not. Right here, right now. So this is a program started by the Governor of Virginia in November 2022, and I was a part of this program since then. And they have a lot of resources. Before calling to 988, they have a lot of resources on their website. You can look into that. I have some information here in the flyers, so I will not take your much time about that. So you can reach out to their resources, whether it's a training, whether it's a licensing, whether it's any other help. And as of now, I think they are funded this program, and they started around about $350 million per year. And within 1 year, they raised the funding to $650+ million.
My personal ask would be get all the board members and the priest on the gateway and the mental wealth training. Then the second call to action would be for us to work out. So we're not asking the temples to be a solution-based for those that are going through this, right? We're just saying that provide the resources to the community to be a bridge. And then I think we'll follow up with the email in terms of what the next steps will be for us to gather and work as a community, right? We're all in it together, and we will have a common goal of serving our people. So with that, I do want to be mindful of everyone's time.
I just want to mention
we are a team of Helping Hearts Coalition, an organization started with this particular mission of awareness about the mental health and mental well-being. specifically oriented towards our children, our adults and elderly population. So today is the first initiative from our group, our team members to educate, to talk to our faith leaders, who are the first gateway for our community, where our community can come talk about their, not even the issues, but in general, how they're feeling, what they're feeling, where to get help, what kind of help is available. So that's the big purpose of this conversation today, to make the public and the faith leaders aware that there is help available, and we will, down the road, we will continue to educating what to watch for, what to listen, what to say, what not to say, and where to seek help and where to seek guidance. So with that purpose in mind, this organization was started.
I want to first of all thank this organization for taking up such an amazing endeavor to get mental health access to communities in need, and particularly the Sikh community, where there is a need and lack of access. Just like in any community, there's what we call stigma. There's this sort of barrier to access to care because of worrying about what the community is going to think or what others are going to think. And so we've had a discussion today about stigma, about confidentiality, and how a person can safely access care without that judgment, and how to start to recognize some of the symptoms of depression and down the road other mental health concerns, and how they impact not just the community, but the community at large, and they have a ripple effect, not only that starts from the individual, but that continues on a worldly level. Depression, anxiety, there's concerns of OCD, there's a lot of these mental health concerns that do exist, just like physical health concerns, and how to deal and tackle with those situations, and what not to do in those situations, and how to be supportive, utilizing the Sikh perspective that Gurbani already gives us, and how to optimize care and delivery, not only of Gurbani, but making you physically strong, making you mentally strong, with the ultimate goal from a Sikh perspective to make you spiritually strong and developing intelligence in all those fields. So that's kind of a synopsis of the conversation we had today.
I want to thank everybody, the whole organization, to invite all of us to talk and recognize mental health problems across, and especially to talk about it in our Sikh community, which is a step. To solve any problem, first we have to recognize the problem. And this is the step in the right direction. So, ਬੇਨਤੀ ਹੈ ਕਿ ਸਾਨੂੰ ਇਹਦੇ ਬਾਰੇ ਗੱਲ ਕਰਨੀ ਚਾਹੀਦੀ ਹੈ, ਤਾकि ਸਾਰੇ ਇੱਕ ਦੂਜੇ ਨੂੰ ਸਮਝਣ ਸਕਣ ਤੇ ਇੱਕ ਦੂਜੇ ਦੀ ਸਪੋਰਟ ਬਣ ਸਕਣ। ਇਹੀ ਵਾਸਤੇ ਸਾਡੇ ਗੁਰੂ ਮਹਾਰਾਜ ਨੇ ਸਾਡਾ ਸਿਖਾਇਆ ਹੈ। ਉਹਨਾਂ ਦਾ ਮੈਸੇਜ ਹੀ ਸਾਨੂੰ ਹੁਣ ਵਾਪਸ ਸਿੱਖ ਕੇ ਇੱਕ ਦੂਜੇ ਨਾਲ ਸ਼ੇਅਰ ਕਰਨਾ ਚਾਹੀਦਾ। ਤੇ ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ।
This was really a very eye-opener for me. First of all, as we heard, this is May Mental Health Month, and it's our collective goal that humanity survives and thrives, and that can only be happen if we are all happy and healthy. And health only comes when we have both mental and physical health. And there was a great awareness and education over here. I want to personally thank Dr. Ravi Singh. I learned a lot, and I'm going to try my best to take this awareness and education further. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.